Hello, my name is Dr. Sameer Shamshuddin. I'm a consultant radiologist practicing in the United Kingdom. I'm delighted to introduce you to RefineRad, our brand new product, which is an AI-powered complete radiologist suite. I'm the director of FRCR Tutorials and proud to present you RefineRad as a product of FRCR Tutorials. So what is RefineRad? It's not just another ChatGPT, Gemini, or any other AI model which people often tend to use to generate refined reports. It's much more than that. And we have kept the pricing very minimal just to cover the cost and cover the running costs and make sure that many people can use it. There is an introductory offer which may run for a couple of months. After that, the pricing is bound to increase. So it's a one suite and a complete workflow, and you can generate refined reports by just typing in some rough notes into the input section, and the generated report will be in a UK NHS style consultant prose verbosity. You can also select the level of verbosity. It can be a concise report, standard report, or a detailed report. I will walk you through all the features, and it has got chat assistance for both reporting as well as ERAD Shield, and lots of exam features as well. So let me walk you through the RefineRad product. Okay, so to sign into RefineRad, you click on the sign in button, and if you are not registered, you can register with an email address and password or sign in with Google. You accept the compliance and legal agreement, and then you will land into the reporting suite. So you can see there are different sections in this report. So the main workspace is the input area and the output area, and then there are a few tabs which is self-explanatory. So one is reporting suite, ERAD suite, there's user guide, dashboard about your plan, etc. Responsibility, which is the governance process behind RefineRad. Please have a look at this. Whatever output you generate, it's really important to remember that user has the maximum responsibility, and RefineRad is a drafting tool to process your reports, advice and professional learning, and radiologists should accept the full clinical and legal liability for the final professional opinion. So you can go through the legal framework. We have done a lot of work to ensure that we match the required data protection standards. We have an appointed clinical safety officer, that's myself, and you can see all the efforts we have put in to make sure that this is a secure platform. So there is a DPIA summary of RefineRad. I'll let you read this, and if you have any queries, you can contact us on admin@frcrtutorials.com. The product has been developed with my core team, Dr. Ravi Uppur, Kapil Shirodkar, and Praveen Wali. We have put in a lot of effort and in developing this fantastic product. So let me walk you through the product. So the tabs are self-explanatory, and when these two tablet, which is built together, reporting suite and ERAD suite, is the main area. Some radiologists have a preference to look at their input and output reports left and right, and some people and top to bottom. So you can customize your workspace in stack mode or in split mode. I prefer split mode, and you can see in the input section there is an area where you can type your rough notes to generate a report, and there is also a smaller section called history where you can copy paste any of the previous report. We have intentionally not included a voice recognition software because that was not the intention of building RefineRad. There are multiple softwares out there, fantastic voice recognition softwares from Nuance, Ognito, etc. And every trust has got a pack system with the VR software, so there's no need to have one more VR to dictate into an external platform. So what you can do is you can either type into this box or report as you would normally in your own pack system and copy paste the indication technique, whatever you need to copy paste into this area and hit generate refine report. So let me just demonstrate you with one simple case. So I will say indication, knee pain following football tackle, and x-ray done yesterday shows a bone fragment on lateral aspect of tibia. Okay, so currently we have done an MRI of the right knee, and when you're reporting MRI or CT scan, what RefineRad helps you is you don't have to dictate in any structured order. You just pick up all the findings and keep talking into your reporting platform and just copy paste the findings. So for example, I have seen a Sigon fracture, I have seen ACL rupture, I have seen medial meniscus bucket handle tear, then ACL contusion pattern, and rest of the scan maybe an effusion, rest normal. You don't have to type that, but I'm just giving you a brief idea of what you can do. I also want to show you another feature. So you can see that once you put some stuff in here, it will activate the generate refined report. If you accidentally put any hospital number, say 1 2 3 4 5 6, so the system automatically recognizes that this is a NHS hospital number, or if you put a name, say Dr. Sameer, or you say Mr. John Smith, so all these things, or if you say date of birth 03/08/07/2016, something like that. So if you put any of these information, the system will automatically recognize that there is protected health information or patient details, and it will not let you generate refined report. So it will highlight all of this in red, and you have to click fix, and then it will list all the protected information that's been picked up. So this area is all working within your own local cache, so it's not going into any server. So this is safe, so it's not yet left the NHS working scenario or working platform. So if you click redact remaining, so it will just pick up everything and say redact, and everything's redacted. Now it's ready to generate a report. So click generate refined report and see the magic. So you can see a full-fledged complete UK style report that's been generated by the RefineRad in the output section. So it does include indication, comparison, technique, findings, impression, and brief recommendation, what you need to do next. So it's a beautiful product, and it gives a verbosity level very similar to how UK consultant radiologist practices. Sometimes you may want to add some grading. So if you're reporting a CT chest abdo-pelvis, or if there's a pancreatitis, or you want to stage a disease, or even in MSK if you want to grade an ACL rupture, so you click grade and stage button, and it will update the report with relevant grading that is applicable for this report. So it is searching the database and looking for accurate grading. So here you are, the ACL is completely ruptured, so grade 3, that's correct. A bucket handle tear, that's also grade 3. And so similarly you can use all of that. One more feature with RefineRad is some consultants or radiologists prefer smaller reports, some people prefer standard reports, and some prefer a larger or a more detailed report. So you have a level that you can recognize. So you just click on the drop down icon on the regenerate button, and if you want a detailed comprehensive report, click detailed, and it will generate a further larger report if you wanted. So this might be useful for head and neck radiology, neuroradiology, and things like that. So there you are. So that gives you a report. So this is the report generation part of it. I know many software, there are AVT softwares in the market which can do up to this point, but where RefineRad takes it to the next level is adding the chat assistant. So if you click on Rad Assistant, you can create MDT notes. So if you're preparing for orthopedic MDT in this case, so you just click on MDT notes, and it will give you template that you can use to copy paste into your, so that will save you a lot of time. So if there's an MDT question, it says reviewed for orthopedic sports medicine MDT meeting dated, so you just include, when you copy paste you can include the date of the meeting, and then all the notes. If you want it in a briefer format, so you can say succinct summary, detailed version, and things like that. Say if you want to flag this result to a clinician, so you can do that one also by asking email referring clinician, and that will draft a professional email that you can copy paste into your email software and inform the clinician. And it also gives you references from that is relevant for this case. If you are a registrar, maybe a year 1, year 2, you have not heard about a second fracture and you want to learn about it, and if you click on teach me about this case, then the AI model will teach you like a registrar being taught by a consultant. So you can just wait for a few seconds and it will generate. So the pathology identified in this report represents a classic high energy pivot shift pattern, and it will give you a brief overview of the condition that's mentioned in the report. So this is fantastic news because you can learn from literally every case that you report. So you don't have to go to Google, search about the case, look for articles, go. So if you click on this, it will open up Radiopedia, or you can click on references. It will give you a lot of other references like Radiopedia, or also Google Scholar and things like that. If you are preparing for FRCR 2A and you want to know if there can be a single best answer question, so you can generate a single best answer question and answer, as well as some reading material for the 2A preparation. So that's your SBA question, and then explanation of as to why B is the correct answer. And then there are some key learning points, and again lots of references. If you are preparing for FRCR Part 2B, for the Viva scenario, you can get this case in the Viva, and you will we have introduced examiner logic into the software so that you will see a conversation between examiner and candidate as part of the FRCR 2B Viva. So if you read this, you'll get an idea of what questions you can get in the exam, and how they will ask, and what answer is expected. So this is a fantastic opportunity to understand how the exam works, and how to answer the questions that's asked in the exam. So this is a fantastic feature. So reporting, it doesn't stop with reporting. You can learn about the case, you can interact with clinicians, you can generate SPAs, you can learn the Viva pattern for any of these cases. And if you want to know the management protocol, so this is where most people really struggle with, like if you know how to report but you don't know what happens next. So if you want to know what happens next in such cases, you click on clinical management or recommendation follow protocol for these patients, and then you get to know how second fracture or bucket handle tear is managed. So that's fantastic. So it's a complete package, right from the word from rough notes into a detailed report, and then to email interaction, then for learning, and then understanding management. And if you have anything else to ask, you say draft a patient explainer email in layman language. It will do that also. So you can literally interact with the chat model with your own questions, and you can see the answer. So it is a patient letter, say your recent MRI shows that you have sustained a significant injury to your right knee involving several different structures. So it's quite a good platform to use. So let me exit the chat model, and to go to the next case, you just click start fresh, clean, wipe and reset, and the slate is clean. Okay, and then I want to introduce you ERAD suite. So what is ERAD? So the role of radiologist is not just reporting in UK. So we get a lot of questions from the general practitioner about what's the right type of imaging to do, or you're reporting in a duty radiologist session and the radiographer will ask you, I have a patient with coming for a neck chest abdo pelvis, he had a little bit of an allergy last time, what should I do? Or for a CTPA and the EGFR is 23. So lots of similar questions. So if you don't know the answer, this is where you type. So let's just say GP asks about patient with migraine. It's a very common question we tend to get. What is the best imaging? Can I request MRI? Okay, so then you click on the generate advice, and it will show what you can reply to the GP based on evidence available in literature. So a couple of seconds, you have a complete reasoning behind your answer. So that's the clinical rationale, and then you can say perform a comprehensive neurological exam to exclude focal deficits, papilloedema, assess for red flag features. So MRI is the gold standard, but if it's only with a red flag feature, and then if you want a concise version, you can have a brief and focused version as well. So again, just like a report, you have 3 different layers of reasoning and verbosity. So a concise version: do not routinely offer neuroimaging for patients with classic migraine history. Perform a comprehensive examination. Diagnosis should be based on clinical criteria. Request for an MRI brain only if red flag features are identified. And then there is a guideline from NICE, BASH and iRefer. So if you click on any of those, or if you right click and open a new tab, that should take you to the NICE guidelines. So it's fantastic. And then you have an eRAD assistant similar to the RAD assistant you had in the reporting suite. If you click on that chat model and you want to tell the GP in a formal GP advice and guidance, so you just click on that, draft a formal response, and it will draft you a response. Okay, and then say you want to put this in a more lead consultant tone, so you can change the tone. So put it as a lead consultant tone. And that will give you a much more comprehensive results. So let's try another scenario wherein a radiographer asks for, can I proceed to do CTPA with EGFR 28, right? So you just click generate advice. And then wait for the output. So there's a lot of data that's being looked into in the background, and that's why you're having a little bit of a lag, but that's good. So you don't want a very super quick not so good answer. So here comes the clinical rationale and recommendation. Proceed with the CTPA. It's a life savings investigation. Do not delay the scan. And then it's all the references that it has picked from. So you got RCR guideline, so as well as a European Society of Urogenital Radiology contrast advice. So again, you can use the verbosity level, you can have a standard and things like that. Use the chat model to draft a letter and things like that. So one more place where you can use eRAD is to say you have a complaint, right? So you can do a complaint complaint saying Mr. colon cancer on CT. So CT, please reply why, and then or something like that. Patient was not happy, so you can use the eRAD to include a complaint response and things like that. So this is the clinical rationale, and it's highly sensitive, but it's not a perfect screening tool. And maybe the patient didn't have CTC or whatever, and then there are references. And using the eRAD, so you can say you can use it as an incident review or a complaint response. So please draft a professional and detailed response to your formal complaint regarding this case. And then I've just given one sentence in it, but here is a UK style reply to a complaint. So this is quite a useful package wherein you can use to draft your response to complaints, incidents, use it for advice and guidance, use it for making MDT notes, and a lot more than just reporting. So yes, RefineRad is not just a reporting suite, it is a complete AI powered radiology suite which covers whole scope of practice, right from reporting to dealing with clinicians, to dealing with colleagues like radiographers, as well as teaching registrars. So, and for the registrars to learn and prepare for their exam. So we have put in a lot of effort. So please go through, please have a trial. So you do get a 7-day free trial with the product, and let us know what you think. And we would be delighted to have you as paid users, and we look forward to even improving the software at some point. So a couple of things. So user guide, you have a start walkthrough. So there is a guided walkthrough about what RefineRad can do, so you can go through this. It should come up on initial login, but if you don't find it, this is where it exists. And then you have a detailed how to use guide for both ERAD and reporting suite here. Dashboard will show your user account status, number of reports generated, etc., and any upgrade plans available. That's pretty much about RefineRad. I hope you liked the product. We have a very simple and transparent pricing. You get a free trial for 7 days to try 10 outputs. It can be either reports or advice, and again few chat features. Try your MDT and see how it goes. FRCR 2A. The Pro version gives you a good amount of 200 outputs per month and unlimited chat features, and Pro Max version, just for another £10 extra, you get 500 outputs, all Pro features and a priority air processing. It's a slightly faster version. So it's a one suite and a complete workflow. You can do a lot of stuff, and yeah, it is for consultant radiologists, it's an administrative shield. You can reclaim at least 1 to 2 hours of your day. And for radiology trainees, you can literally learn from every case. What if every report you wrote also prepared you for the FASIA? So you can have Viva simulation, active learning, report to pass. So report the case, pass the exam is what I would say. So we are a team. This is our team. Myself, Ravi, Kapil, and Praveen. We put in a lot of effort in developing this product, and we are quite excited to introduce you to RefineRad. Thank you for watching, and we would love to hear from you.